In India, 2 people have in the last week's Nipah virus, and they are afraid of carrying deadly illness that killed 75 many infected people. Public officials in India are trying to include virus instant schools, offices and public transport to stop easily spread disease. Nipah is defined by World Health Organization as a highly priority disease with the potential to start another global pandemia, which makes outbreak a public health crisis. Nipah virus is a zoonotic virus, and at the same time contaminated can be transmitted through food or directly between people. Or says on the WHO website, only disease does spread easily, but incubation time can last up to 45 days. So people carrying Nipah virus do not have symptoms and do feel healthy even if they spread infection to others. Health workers wearing protective gears move the body of a person who have Nipah virus infection. A hospital in Kerala, India. There is no vaccine or treatment for Nipah infection, so treatment is limited to alleviating symptoms: fever, headache, cough, sore throat and vomiting in those who suffer from disease. In severe cases, patients may experience orientation disorder, seizure, coma or brain swelling according to disease control and prevention centers. In fact, some people who survive a Nipah infection have long-term neurological symptoms such as seizures, convulsions and irregular personality changes. Residents add sign on a barricade that was built to prevent road after the authorities declare the region as quarantine zone. Nipah virus can be transmitted to many different animals such as horses, pigs, sheep, goats, cats, dogs and especially bats. Professor Dr. Sunshine Coast University Molecular Engineering Associate Professor of Australia Joanne MacDonald said to Guardian by fruit bats sitting on the hills of trees. A healthcare worker is biologically throwing waste from a Nipah virus insulation center in a state hospital in southern Kerala, India. The existing epidemic was centered in southern Kerala, India, in 2018, 2019 and 2021, where previous outbreaks were recorded. Together with Nipah, he described other priority diseases ILA with the potential to cause the next pandemic: Marburg and Ebola viruses, Crimean Congo hemorrhagic Lassa fire, Rift Valley Middle East respiratory syndrome, also known as MERS, respiratory syndrome, COVID-19 and Zika virus. The last disease in DSO list is the creepy disease XUS, a creepy code name that uses a code name for an unknown disease as cause of human infections. Health workers wearing protective equipment carry a woman with signs of Nipah virus to the isolation ward in a state hospital in Kerala, India, as new disease agent. Whether virus, bacteria, fungus, or another pathogen will probably not have any vaccine or small number of treatment if any. Dr. Richard Hatchett said to Telegraph. This is not fiction.